The Day 5 of the CareerBoost Initiative by the Eastern Pathways Youth Foundation brought on board speakers that took us on topics universal health and infrastructure development. While the UI and UX lecture continues, the sections were anchored by our moderator, Bello Malik Bellomi.
You're welcome to yet another exciting episode of the CareerBoost Initiative for African Youth.
Welcome to Day 5. My name is Ololade Adesuyi. At this point, I don't think I should even be introducing myself again, because I want to believe that by now you already know my name and why I am here. But in case you have forgotten, my name is Ololade Adesuyi, and I am your UI UX design facilitator for this CareerBoost Initiative for African youths. Yes, so we have gone through 4 days now, and today is the 5th day. I want to believe that you guys have learned so much and you've been participating actively in all of the assignments, all of the activities that I have been giving you guys. Right. Let's get straight into it. Yesterday, we talked about user flows. Do you guys remember? User flows, flow charts, starts, actions, endpoints. Exactly. We talked about user flows, and we also learned why these user flows are very important to your design process, right? And why you need to conduct or you need to create a user flow before you even start designing at all. Right. Now, there is one other thing that you need to do before you start designing too, and that's what we're going to be looking at today. This thing is called wireframing. But before we get into it, I'm just going to before we start exploring what wireframing is, before we start learning how to create wireframes, or in fact, I believe that by the end of today, we would have learned how to create wireframes for maybe, let's say, for apps and for websites, right? And that you would also understand what these wireframes are and why they are very important to your design process. So let's begin. What is a wireframe? What is a wireframe? So a wireframe is basically like a blueprint for your app or your website. Now, I'm sure some of you have seen architects, right? They design they design the plans for your houses that you live in. So before you start building your house at all, or before your parents started building their houses, they had to go meet architects that drew like a sketch of what the house layout is going to look like, right? So that's basically like similar to what a wireframe is. So before you start designing at all, you have to like come up with the layout of what your website or your mobile app, whatever it is you're designing, what the layout is going to look like, right? So like I said, just like people that build houses, it's architects, yeah, not the bricklayers now, it's the architects. Before they even start, the architects come up with like a blueprint of the house. So this is what the house is going to look like at the end of the day. So they just sketch and then they do like a plan layout too. Exactly. So that's similar to what we would be doing in this wireframing. So there are certain things about wireframes that I would want us to know, right? With wireframes, you don't do colors, you don't add images, nothing fancy. It's just plain. If you've seen a, what do they call this thing? Plans, right? The plan of the house. If you've seen a plan of the house before, it's usually in like black and white. Nothing dramatic, nothing fancy. When you see the layout plan of your house, exactly, it's just in like black and white. So similar to wireframes. Wireframes are strictly plain, nothing fancy at all, right? It's just you planning what you want the layout of your website or the layout of your mobile app or web app, whatever you're designing to look like. Now, there are certain things about wireframes I would want us to know, right? First, your wireframe has to be simple, very simple, because it's usually just outlines. I don't want to start sketching and showing you guys now so that I don't go deep into it before we start. Or if you know what your mobile apps look like, your wireframe is just going to be like something like this. I don't know if you guys can see this, but yeah, it's just going to be basic, simple stuff like this. Very simple, just outlines. Nothing too dramatic. Nothing too dramatic. You don't include colors, like I said earlier. You don't include images. You don't include nothing, no graphics, nothing, just outlines. Oh, I want my mobile app to have a button here. I want my website to have an image here. So you just sketch out the outline. You're not designing yet. It's a wireframe. It's a sketch. It's a blueprint. It's a wireframe. That's what it's called. It's a wireframe of the actual design you're going to end up doing. Then the next thing, apart from you making sure that your wireframe is simple, you have to make sure that you focus on how the app or whatever you're designing, maybe website, how it's going to work. Now, remember you've learned user flows earlier and you've learned about user personas. So now you're combining all of those things you've learned to make sure that what you are drawing, what you're sketching in your wireframe is going to be something that is going to give them the perfect solution to whatever frustration or whatever need they have, right? So you have to make sure that you focus on how whatever you're designing is going to work, and how the people that are going to use it, how they are going to navigate through it. So that is why you're coming up with a wireframe, to make sure that, oh, when they click on this button, it takes them to this page. Then you just sketch what is even going to be on this page. Then you just start sketching, okay, this is going to be here, this is going to be here. It helps you to like make iterations, changes early on before you start designing, designing properly, right? So now, there is another thing. You have to make sure that it is something that, if me myself that I just come up, I'm like, oh, what are you working on? Without even seeing the design, you can just show me a wireframe like, oh, I'm thinking of putting buttons here and putting images here. What do you think? And I can like, okay, why don't you put it to this way? Why don't you do it this way? Why don't you do it that way? Exactly. So that's why wireframes are like important. So again, why do we use wireframes? So like I said, to make sure that before you even start designing, you have everything on lockdown. You've thought about every single thing. Is why you should do your wireframes. Imagine designing, you've designed maybe like 20 screens, and then you now realize that even the most important screen, you did not cover it. If you do your wireframe, when you look at it like 3-4 times, you're like, oh, I missed out on a page that is supposed to be in between these two. You can just sketch it and then take notes, right? So wireframes will help you as a designer to make sure that the ideas you have, they're like, you like, it's like you go through your mind, you come up with different ideas. What if I put this here? What if I put this one here? it's not going to work, let me change it. You can just cancel it, like draw a line over it and start all over again, because there are different tools for wireframing. I mean, online tools, but you can also use your pen and paper to sketch your wireframes. But yeah, so with wireframes, they would help you to make sure that your ideas and your concepts are on point before you now start moving on to the actual design itself. So you can easily visualize how you want your elements to be fit together on your screen before you now start designing properly. Another thing that wireframes will help you to do is to help you focus on how your users will use the app, basically. So like I said earlier, it helps you to think about your users. So when you're already thinking, what will they click on this page? To get to this next page, how will they even get here? You draw another wireframe. Okay, this one has already taken care of this. Now, how will they even, what will they do on this page that will take them to the next page? Okay, I need to put a button here. Exactly. So that's how wireframes work. And then with wireframes, before you even start designing plenty fine things, and then you now realize that you've done rubbish, wireframes will help you to quickly, like I said, quickly create and like iterate. You can cancel it, you can start over again. Imagine designing something very fine and only for you to now start all over again from scratch. How would you feel? Exactly. So with wireframe, you can look at it and realize that, oh, I've done rubbish here. I need to start all over again. I need to do this thing, or I need to fix this part. See this sketch or this wireframe I just showed you guys, right? If I decide that this is not going to work, I can just do this. I can just like run my pen over it and start all over again. Like, okay, that one will not work. So let me do something else. And then I start sketching. Okay, I think I don't want my image to be too big now. And then I want text to be here. I want text to be here. Okay, but I still want the button to be down here. Okay, maybe the user should sign up on this page. They should give me their email and their password here. Okay, so you see, I'm already thinking like without even designing itself properly. So when I want to start designing, I just have to look and say that, oh, okay, this is where I said my sign up page is going to be, and just continue designing. So that's why we as designers use wireframes, right? So I did this wireframe on a software tool online. I shared the, what's it called? Miro with you guys yesterday. So you can use Miro to come up with wireframes, and you can also use FigJam. I should show you guys FigJam, but it works almost like exactly the same as Miro, right? So yes, so we have different parts of a wireframe. I believe that now you understand what wireframes are. They are just blueprints, they are like sketches, layouts of what the actual design should be. And with wireframes, you can easily make changes before you even get to the point where you start designing proper, right? So again, we have, like I was saying earlier, we have different components of a wireframe, right? We have the header, we have our navigation bar, we have content area, we have buttons, we have footer. I think, let me try to show you guys here. Okay, all right. So this is a wireframe that was done with what tool was this? I think FigR. Yes, a software. I can easily sketch this out too on my pen paper with a pen, but I just wanted to have something fancy here. So yes, we have the header. Headers are usually at the top. Let me zoom in so you guys can see. Headers are usually like somewhere at the top here, right? They're usually at the top of your wireframe, whether your website, whether your mobile app. If you are including an header, it's usually somewhere up there. And it usually contains some elements like maybe the app's name. In this case, I use Structura, right? Could include elements like the app's name. Maybe you can put maybe the logo. If you check your Facebook app, for instance, on your mobile phone, you will notice they have an header up here with the Facebook logo here, up here, and then they have like a navigation menu. You see three lines on the right, or maybe they'll put your profile picture, they put a notification button, something, but you definitely see the Facebook logo up here. That's for the header. Now, for the navigation bar helps you to move around the app easily, right? For instance, on this part, you have your home button, you have your search button, and you have your profile button. That is for our navigation bar. So it helps you to easily move around different pages without getting lost. So you can easily find the information you're looking for by just moving from one page to another. So your navigation bar, it will help you, your users now, or you, to move around your app or your website easily. So it will link you to like different pages, to different sections. You can put things like your home, as you can see here, you see home, your search. So once you click on this, it takes you to your search page. When you click on this, it takes you to your profile page. When you click on this, it brings you back to your home page. So this part here is your navigation bar. You can also have a navigation bar maybe with, they can use maybe there's something we call hamburger menu. You see those three lines that when you now click on it, it will now show you the menu that is hidden inside. Exactly. So that's also your navigation menu. So this is a wireframe that is displaying, this is a footer. So the footer contains links. It's usually located at the bottom of your wireframe, and it contains like external links that you could not put anywhere else on your design. So you have things like your about us, your terms of service, your privacy policy, stuff like that would be found on your footer. Then we also have this content area. That's this part, this entire section between the header and your navigation bar. So this is your content area. So this content area is like the main part of the thing, of the app you're designing, of the website you're designing. The content area is the main part. So it is where your users will see the information that they're looking for. So if I click on the home page, I should see information relating to the home page on this content area. If I click on my search button and it takes me to the search page, I should see content relating to the search I am looking for. And if I click on profile page, this content area should display information related to my profile. Right. And then there's something else that I did not include here. Buttons, basically. But buttons are usually a part of your wireframe. But I didn't include it here because I was working with a web app in mind, right? Just a website, sorry, just display stuff. For your buttons, so when you click on things like continue, you think click on things like next, things like sign up, register, those things are called buttons. So buttons are usually very interactive. They are interactive elements that you click on to perform actions. So if you're trying to sign up, you've typed in your name, you've typed in your maybe your email address, you've given them a password you want to use for your account. The part that would now save all of those information is the button you click on. without clicking on that button, none of the details you submitted will be stored anywhere. So it's just like you're just typing for typing sake, right? So buttons are usually used to perform actions. So if I want to add a song to a playlist, I'll click on add to playlist. That is a button, right? So buttons are used to perform actions. Uh, Moving on, this is an example of a wireframe, like you can see here. But I will want you guys now, obviously, I know you probably don't like seeing this period coming, but you're going to create your own wireframe for a music app. We've done a lot of music related things, so let's just continue. So you're going to come up with a wireframe for a music app. Now the home page of that your app will just contain a wireframe, or sorry, your wireframe is going to be of the home page of a music app. So it's going to contain the header, it's going to contain the navigation bar, it's going to contain the content area, and it's going to contain the footer, right? So should how many minutes should we do this for? I'll say 10 minutes. I'm going to set a timer for you guys to come up with the wireframe. So remember, the wireframe for a music app. Again, you can use your pen and your notes, your pen and your jotter. So if it's a music app, you already know you have your. Let me draw a fresh one. So this is my container. This is my container, and then in here, up here, I'm going to have my header. Down here, I'm going to have my navigation bar. So I'm just going to demarcate like, oh, my music app. On a music app, I'm going to have my home page. I'm going to have a search page. I can have a page for like my library of songs, right? So I'll create another one. And then I can have a page for my profiles. So for my profile, sorry. So I'm just going to write profile, and then I'll write library. I'm already giving you guys expo. No. Then I'll write search and home page. So this is already what I have. Can you see that? And then for my header, I can write maybe my music app, because I don't know. I don't have a name for the music app. So if we add a logo for this music app, I would put the logo up here on my header. But since I don't, I'm just going to write my music app, so that when I am designing, I know that I'm going to put the logo of my music app here. Then the content area, I think at this point I should leave you guys to just come up with your own stuff. So remember, the content area is between your header and your navigation bar. Do we need a footer for a music app? If you think so, please put it. But yeah, 10 minutes starts now. All right, so 10 minutes has passed. You guys, I believe that you've come up with a wireframe for your music app. But for your assignment, you're going to continue with that, right? With the music app. But this time, I don't want the home page. I want the page where you listen to music itself. The page where you'd click on play and pause. Exactly that page. So you're going to create a wireframe for that page of your music app, right? So I should be able to see from a wireframe, you should be able to tell, okay, this is where the person will click on play, this is where the person is going to click on pause. Exactly. So wireframe for that. Before you even start, let me just refresh your mind. To do this, you can use your mirror. I'm sure by now you're familiar with mirror. I expect you to keep playing with it when you get home in your free time, just to get a hang of it. You can use tools like mirror for your wireframe. There are other tools online. We have whimsical, right? We have balsamic, but just check out all of those tools and stick to one that is like you find easy to navigate or easy to use, right? So after you've gotten the materials you want to use, materials in this case being either your pen and paper, your pencil and jotter, or your mirror, or your balsamic or whimsical, whatever you're going to use to draw this wireframe. Now start thinking of how you want your layout to look. Usually, like you've seen from what I have done, you will draw a rectangle, right? Then you can now start putting in things inside that rectangle. So you can start with your header, you can start with a navigation bar section, then you can create a larger rectangle in the middle for like your content area, and start adding adding elements to your content area. Remember, in your header, what you would you see in your header? You would see a logo or your app's name, and then in the navigation bar, what would you see? It's still even showing here, so you can see that you would see the sections that you want users to be able to access easily from anywhere on the app, right? So it could be your home page, your profile page. In my case, for the one I drew just now, I had library, and then I had a search page. Then in the content area, you can think about how you want to display the songs. Will you show the song title? Will you show the lyrics? Do you want to include the play and pause buttons? Just think about what you want. You can check out other music apps that are available online or that are on your phone to see how they do their own, and then come up with your own wireframe. Make sure to focus on the layout. You're not yet designing, you're just trying to like think about what the design is going to end up looking like, making sure that you cover everything in your wireframe, right? Good. So I guess we'll see. Before I wrap up, let me just remind you, refresh your memory from today's class. So wireframing is what we talked about today, and I mentioned that wireframing is a very essential part of creating user-friendly apps or websites, anyone. Now, with wireframing, it helps you to like plan out where everything is going to be before you start adding colors, before you start adding images. It just helps you to make sure that you are designing the correct thing. You're not designing rubbish, right? If I ask you tomorrow, what are wireframes? I don't expect anybody to stutter. First thing you can say is maybe wireframes are they act as blueprints, like I mentioned at the very beginning of this class, and that they would help you to come up with ideas quickly and also improve on those ideas, right? So it will also help you to like get feedback quickly early on in your design process before you design a lot of nice things and then you realize that it's not going to work. Right. I guess I'll see you guys tomorrow. Please make sure to do your wireframes. Please do your wireframes, and we will see in class tomorrow.
And everyone, it's such a pleasure to be here and to be part of the great works that Mr. Adegoke and his team are doing with the SDG or in the SDG sector, with the organization, the InStride Pathways Academy. And I'm glad to be here to talk to you briefly about universal health coverage and it being a realistic goal for global health equity. My name is Kehinde Joah, and I'll take you on this short journey of universal health coverage. And I hope not to take much of your time. And hopefully, in the next 15-20 minutes tops, we should be done. Okay, so just to take you back to a review of what the Sustainable Development Goals are. Currently, we have 17 Sustainable Development Goals, and works are being done in each of this sector to be able to attain. So one of the first one is that there should be no poverty and that there should be zero hunger. And the one that I'll be focusing on majorly is SDG number 3, which is good health and well-being. However, one of the things that I've come to realization is that you cannot have good health and well-being when the people you're trying to give the good health and well-being are hungry, when they don't have quality education, and when there is gender inequality, or when they don't even have clean water and sanitation, when their lives on the planet Earth is not even safe, when the climate weather or the climate condition it's not favorable, people cannot have good health and well-being. And this was good to tell us that all these 17 sustainable development goals are dependent on each other. You cannot achieve one without the help of the other. They are all depending on each other. So in as much as we are going to be focusing on goal number 3, which is good health and well-being, we also want to look at other goals, because you cannot achieve good health and well-being, like I said earlier, without every of the 17 goals. Okay, so SDG 3 at a glance. Basically, what SDG 3 is telling us is that we want to have good health and well-being for the entire population on Earth, right? And for us to have this good health and well-being, this SDG 3 has been categorized into different targets just to make it easy for sectioning and easy for it to be achieved. So the first target for SDG 3 is that we want to reduce maternal mortality. And maternal mortality basically talks about mothers dying at the point of giving birth. And this is one of the commonest causes of death in Nigeria, basically because we don't have good healthcare sector. And so you have women who are pregnant and don't even have access, to healthcare. They don't have access to antenatal care. And so most times when they come to the point of giving birth, they end up with complications and at the long run death, right? So one of the targets is to reduce maternal mortality, to fight communicable disease, to prevent and treat substance abuse, which is one of the things that it's currently affecting the younger generations. One of our targets today is target 3.8, which is to achieve universal health coverage. And what universal health coverage basically means is that people have access, to full range of quality health services that they need, when they need them, where they need them, and without financial hardship. And this has been one of the biggest challenges of healthcare, that you get access to healthcare services when you want them, where you want them, and without having any financial hardship. If we're being realistic, I think this is far-fetched from achieving the universal health coverage goal for 2030. And using Nigeria as a point of contact, I think, I might not be sure with my statistics, but I think that currently not up to 50% of Nigerians have access to healthcare when they want it, where they want it, and then being able to afford it without any financial hardship. And so universal health coverage actually covers a broad spectrum of essential health services, in the sense that we look at the aspect of health promotion and prevention. We look into the aspect of treatment, we look into the aspect of rehabilitation, and even palliative care, right? Palliative care talks about care that you give to the older people or people who are in end-stage diseases, like people with chronic kidney diseases that they need to be managed to the point of death. So on this slide, I'm basically trying to show us a glance of what SDG 3, or rather what the target 3.8, which is universal health coverage, what has been done so far, and the challenges we still have. Okay, so coming from here, we can see that 146 out of 200 countries have already been able to meet one of the targets that, like I said earlier, that we are supposed to, one of the targets, which is target 3.1, is that we reduce maternal mortality. And according to statistics, about 146 countries out of 200 countries have actually been able to, meet up this track. And another achievement so far is that death has reduced. Effective HIV treatment has actually has been in place, and about 52% of the global population have access to HIV treatment, which is actually possible, and that at least one neglected tropical disease has been eliminated in 17 countries in the world. However, what are the challenges? With the advent of COVID-19 in 2019, so about 25 million children have been able to miss their immunization in 2021, and this was as a result of the global pandemic. Everyone had to stay home, everyone needed to be safe, and so everyone was at home. I believe that is why we have this high increase in numbers as opposed to what we had in 2019. So there was about 6 million increase, from 2019 to 2021. And even looking at malaria cases all over the world, we have an increase. In 2019, we have about 232, million cases. And in 2021, we have about 247 million cases of malaria. This just go to tell you that the target 3.8 is still far-fetched from being achieved in 2030. This is already 2024. And currently in Nigeria, we are nothing close to having complete malaria eradication. And we know that one of the commonest causes of death in Africa is malaria, especially in Nigeria. And this is one of the worrisome statistics, that a woman dies every 2 minutes, from preventable causes that are related to her pregnancy and childbirth. How can we ensure that there is good health and well-being if a woman dies every 2 minutes at the point of giving birth or in the course of her pregnancy? This is really alarming and it's scary, right? So for us to achieve universal health coverage, we need to look at each of the targets, and each of the targets needs to be met for us to be able to achieve the global health and well-being for every life on earth. And so the universal health coverage has a mission and a vision for it to be achieved in 2030. And the mission, or rather the vision, is that we want a world where all the people have access to the full range of quality health services that they need, when they need it, where they need it, and even without any form of financial hardship. And their mission is to accelerate sustainable progress toward universal health coverage, and they do this by focusing on building equitable and resilient health systems in such a way that no one is left behind, and that they are able to provide foundation to achieve health security. Okay, so what are the key facts about the universal health coverage 2030 so far? And so one of the things that I think is pretty interesting is that there have been improvement on health services. However, since 2015, these health services improvement have been stagnated, and the proportion of the world population that has faced or that have suffered out of the pocket health spending have increased largely since 2020. And I could attribute this to COVID-19 pandemic, but beyond that, people have had to spend so much money out of their pocket to pay for healthcare services. If we're talking about universal health coverage, is that people also should have access to, health insurance that they could afford, a form of payment that would be easy for them to do. I think currently in Nigeria, we have some form of health insurance, the National Health Insurance Scheme. I'm not sure how equitable that is, but I know that some government workers have access to NHIS. And so I believe that if people have access to NHIS, at every form, at every level, not just for government workers, then it is going to reduce out of the pocket spending. And we'll probably have a better statistics in 2025. Another thing is that the proportion of the population that is not covered by essential health services actually decreased by about 15%. So taking Nigeria again as a point of example is that more than 15% of Nigerians do not even have access to essential health services. And I know that we have primary health centers in different local governments in the state. However, how effective are the functions of these primary health centers? I know I've visited a couple of primary health centers, and then you go to these primary health centers in Nigeria, and either the doctor is not available, or even the nurses that might be available to attend to you are not even they are not well trained. You end up having quacks in the hospital attending to people. And so even when you have access to the health, you're not having access to quality health. And again, like I said earlier, one of the aim of universal health coverage is that you're having access to quality health, not just any health. You're having access to quality health. Another key factor is that when we look at the service coverage, the universal health service coverage has actually increased, from 2000 to 2021. However, there has been a decline again because of the COVID-19 pandemic. But we are hoping that now that things are getting back in place between 2022 to 2026, there should be a great improvement in the health coverage. And finally, about 2 billion people are facing financial hardship. Currently, I think the world population is about over 7 billion. So if we have about 2 billion people facing financial hardship, it means that up to 20 or 30% of the global population are facing financial hardship. And this is mostly as a result of the spending that they have to do on their healthcare. I know that in Nigeria or even in other parts of the world, America, for example, if you fall sick with a chronic disease, let's say you come down with chronic kidney disease, if care is not taken, you end up spending all your life saving treating just one disease. And then you can go into bankruptcy because you are treating just one disease. And so imagine you being a middle class, moving from being a middle class with your level of income to being actually poor because you had to pay for your own health care. This is really alarming. And that is one of the goals that the SDG 3 is hoping to achieve, that through the universal health coverage and health insurances, that people are able to access quality health care without even them spending so much from their pocket. I mean, it's not going to be free, but that you're not spending so much to the point that is affecting your financial status. Okay, so what are the 3 pillars to achieving universal health coverage? To me, one of the important pillars, or the most important pillar, is access. If someone is in Lagos and another person is in the most rural part of Nigeria, let's say in Maiduguri, that person should be able to have access to the same health care that the other people in Lagos are having access to, And so the access is that everyone who needs health services should be able to get them, not just those who can pay for them, right? So if someone needs to have surgery, it should be that because I don't have money to have the surgery doesn't mean that I shouldn't have the surgery. I should have the surgery because I need the surgery, not because I can pay for it, right? And so access is very important. Another thing is financial protection. You cannot achieve universal health coverage when you don't protect the finances of the people. People shouldn't go into debt because they are paying for treatment. Even basic medicine, that something as basic as anti-malaria drugs, antibiotics, even the vaccines you receive, you shouldn't have to pay so much money to get vaccine. I know, there are some vaccines that you can't get, from hospitals. You need to pay for them, especially for children. So I think it is really important that people need to be financially protected. If you don't protect the finances of people, how do you achieve universal health coverage? Again, universal health coverage cannot be achieved if people do not have access to health care and their finances are not protected. And finally, quality. Like I said earlier, the goal of universal health coverage is that everyone should be able to have access to quality health when they need it, where they need it, without any form of financial hardship. And so you cannot give people health care when it is not quality. You cannot give someone drugs for malaria when the person needs antibiotics, right? So we need to be able to have quality health services. We need to be able to have quality doctors at every hospital, at every government hospital. When I go to government hospitals, I should be assured that the services I'm getting from this hospital is from a quality trained doctor, from a well-trained nurse, from a well-trained medical laboratory scientist, from a well-trained pharmacist. And this can only be if we are hoping to achieve universal health coverage. And so this is just to give us an overview of what universal health coverage what it entails. Again, like I said, that it needs to be quality. You can't give healthcare that is not quality and say that you're giving healthcare. So we need to have quality healthcare. The healthcare needs to be people-centered. Now, one of the things that I have noticed in Nigeria is that government just come and build hospitals in different areas, and they say, oh yeah, we built hospitals. You don't just come and build hospitals. What are the peculiar things to the people in that community? If that community is a community that is suffering from, let's say, schistosomiasis because they are living in a riverine area, are they going to have access to services that would, take care of that disease when people come down with schistosomiasis? So the healthcare that you're going to give people need to be people-centered, right? You cannot give, how do I say this? You don't give the same treatment to everybody. No. The treatment that you give need to be people-centered. If I'm coming down with malaria, I should be treated for malaria. If I'm coming down with sepsis, I should be treated with antibiotics because I have sepsis. I shouldn't be giving anti-malaria drugs when I have sepsis. So the healthcare that you give people beyond being quality healthcare, it needs to be people-centered and it needs to be integrated. Again, when you are forming a healthcare center, you need to bring the people of that community in making these decisions, in making interventions for them. And above it all, they need to be able to afford it. That's why I talked about the financial protection from my previous slide, that the three things that we need in achieving universal health coverage is that we need to have access, people need to be able to afford it, and it needs to be quality, right? So accessibility, which talks about the equity, everyone should be able to access universal health coverage, everyone should be able to access basic health care, and the services should be available wherever, whenever it is needed, and that it needs to be of great quality. And this slide is just giving us an overview of what universal health coverage is. Again, universal health coverage is not just health insurances. This is because when we say universal health coverage is not just about health insurance, is that yes, health insurance is important, but beyond health insurance, not everybody would be able to afford a health insurance. You cannot tell somebody in the most rural part of Nigeria who is living on less than 200 naira a day to have health insurance. Some health insurances are as high as 5,000 naira in a month, or as high as 200,000 naira in a month. If someone is struggling to have three square meals rather in a day, how do you expect the person to afford health insurance? This just go to tell us that universal health coverage rather is not health insurance. And so if we want to have universal health coverage, we need to talk about equity. And that is where people having access to basic healthcare services comes into play, that irregardless of who you are, irregardless of your financial status, you should be able to have access to basic healthcare that is provided by the government for the people. And the universal healthcare coverage requires a strong healthcare system. One of the challenges we have in Nigeria is that we have a terrible healthcare system, very, very terrible. We have Minister of Health, and at some point you even wonder what they are doing, because it's like they focus the healthcare system in the urban region of the country. You have the best healthcare system in Abuja, in Lagos, in Kano, the big cities, in Port Harcourt. What happens to places like Yobe? What happens to, Ebonyi State? What happens to other states that are not as big as Lagos and Abuja in terms of their GDP? What happens to them? Do they not deserve to have the best healthcare system? So one of the goals that universal health coverage is fighting for is that everyone should have access to strong healthcare system, right? And that universal health coverage is not a one-size-fits-all approach. No. Again, what you would do for someone in Nigeria would be different from what you would do for someone in Algeria, which is in Northern Africa. So you need to sit down and look at the infrastructure or the things that will work for someone in Nigeria and the things that will work for someone in another part of the world. For example, you have America. America doesn't have malaria. You cannot be pushing finances or healthcare financing to America and say that you're targeting malaria. Malaria is not their problem, right? You would want to focus that one on Nigeria. So This just go to tell us that universal health coverage is not a one-size-fits-it-all, and that universal health coverage can actually improve health outcomes. I mean, that is the goal of universal health coverage, that at the long run, your health is improved, and even as your health is improving, your finances are being protected. Okay, so just to give you an overview of the trends of the coverage of universal health services and all. This is pretty interesting because looking at this map, this is Nigeria. Nigeria is at a balance of 44 to 47. I'm struggling to believe these statistics because I don't think Nigeria has gotten to. I feel Nigeria is way at 39 to 43 in terms of our own universal health coverage. I don't think we have much health coverage in Nigeria. You cannot go to the most rural part of Nigeria and have access to quality health care, all right? One of the few places that have actually made significant progress in their universal health coverage service is, the southern part of Africa. We have South Africa, I think this should be Botswana. And then you come to North Africa where you have Algeria. And these are countries that have been amazingly well for themselves in terms of universal health coverage. And so, like I have been saying, universal health coverage is not a standalone thing. And when we achieve universal health coverage, it will in turn affect every other part of people's life. Like I said earlier in my first slide, that good health and well-being is dependent on every of the other SDG goals, right? That you cannot achieve good health and well-being when you are poor. You cannot achieve good health and well-being when your lives are not safe on the planet. So basically, this slide is just to tell us that universal health coverage is not a standalone thing that is dependent on every of the other 17 or rather 16 development goals. And what I try to do here is just give you an overview of some of the most important ones that I think is interconnected with universal health coverage. So, human rights. We're trying to protect the human rights is that you cannot protect human rights when they do not have access to healthcare, right? You cannot eradicate poverty when people do not have access to universal health coverage. Again, remember, the goal of universal health coverage is that people are able to have access to quality healthcare when they want it, where they want it, without any form of financial hardship. So if universal health coverage is not putting you on any form of burden for financial hardship, then I feel that through that there will be some form of eradication of poverty because you're not having to spend so much on your healthcare. If you don't spend so much on healthcare, you have much more left, to spend on other parts of your life, maybe for your feeding and for your housing, and that equality and non-discrimination. So what is the importance of universal healthcare? I've been saying this and I'll keep saying this, is that everyone is able to have access to healthcare. Everyone is important, regardless of who you are, what you have, or what you don't have. You should be able to have access to at least basic healthcare, and that improve health outcomes. One of the things that universal health coverage is also planning or is hoping to achieve is that if you come to a healthcare setting, you should be able to come out with an improvement. I know it's not almost always possible. Sometimes you go to a hospital and things happen and the person doesn't make it. But that is not the point. The point is that when I come into a healthcare setting, let's say I have malaria and I come into a healthcare facility, the goal of it is after treatment, my health outcome should be improved, right? That is the goal of universal health coverage, that you come to access healthcare and at the end of it, your health outcome is improved. That you should have economic benefit and social benefit. Yes, this is important. You cannot be socially happy if you are not healthy. And universal health coverage wants you to be happy, wants you to be healthy, and wants you to have enough, so that you don't spend so much on healthcare, so that you can have enough for other things in your life, and so that you can have access to other social benefits. So, remember, we are talking about global health coverage and how global health equity is important in achieving global health coverage. So I feel, or rather I know that the word equity, right, actually means that there is absence of unfairness. Equity is that you treat people not necessarily equally, but how they ought to be treated, that you try everything possible to ensure that the services that is needed by everyone they get the services for their own condition, for their own situation, right? So you are trying to make it equitable across the globe, equitable across the globe. So basically, when we're talking about global health equity, it is the idea that everyone should have the same opportunity to achieve their full health potential, regardless of their social position or even other factors. And like I said earlier, that global health equity can only be achieved through universal health coverage. And an example of global health inequality, for example, is discrimination. This is one of the commonest things we have in Nigeria. Let's say I come to a healthcare facility as a young girl, let's say unmarried young girl at the age of 13, and I'm coming to say I'm pregnant and I want to have access to healthcare. I want to have access to antenatal care. One of the first things that the nurses would say to me is, I think, not even I think, first I'll be discriminated because as a 13-year-old girl, you're not expected to be pregnant. Yes, you're not, but then it happened. Should you be discriminated because this happened? No, you should be able to have access to healthcare irrespective of your situation. Another good example is people with HIV. When people come to the hospital and they reveal their HIV status, they get discriminated, you know. The idea behind global health equity is that nobody should be discriminated. Everyone should be treated fairly and equitable. And so this is just a framework of how, the strategies that we can use in achieving global health equity. One of the important ones to me is that you're centering your equity based on quality and payment, and that this means that when you pay money, you should be able to get good quality, right? But beyond paying the money, everyone should have access to quality health. And like I said earlier, that when you have universal health coverage, then it should be able to improve the social determinants of our health, and that we should also be able to hold our the health system accountable. When something is not working out, we should be able to speak out, and the government should be able to respond to us. And that we should even be able to improve and integrate physical, behavioral, and also our oral health. Basically, the hallmark of it is that we should be able to engage our patients, our families, and our caregivers. I am a medical person, and I know that sometimes this might seem unrealistic. It might seem like it's far-fetched from being achieved, but I know with universal health coverage and with the aim of achieving all universal health coverage by 2030, I believe that if all hands are on deck, then this is definitely achievable. But so far, what are the challenges in achieving the universal health coverage for our 2030 target? I think one of the most important ones is unregulated delivery system, right? And this is covering about 19% of the challenges that we have. Unregulated delivery system. And it's one of the commonest problems we have in Africa, Nigeria specifically. I'm saying Nigeria because I am from Nigeria. It's nothing is regulated. You build a hospital today and nobody goes back to check how well this hospital is functioning. You build a health center, and it's not just about building health center. How do you manage it? How do you sustain that health center to be able to serve the needs of the people in that community? Then we have lack of quality. And another thing is we have an aging population. When you come to Europe, you come to America, we're having an increase in aging population. And when we have increase in aging population, it means that the percentage of young people that are available to work is reduced. When you have reduced hands to work, it implies that you're going to have challenges in achieving your goal, because the people that would actually work to ensure that we achieve universal health coverage 2030 is the younger generation. But when we have old people in the population, rather, we're instead using our energy in taking care of the old people instead of using our energy to even serve the younger people, right? So this is like a big challenge. Another challenge is failures in services expansion. We need to be able to expand our services to be able to reach everyone. Again, I keep saying this. Remember that the goal of universal health coverage is that everyone, everywhere should have access to quality healthcare services when they need them, when they want it, without any form of financial hardship, right? So what is the way forward? How do we achieve universal health coverage? We've been talking about the challenges. We've been talking about, things that should be done, that haven't been done. how do we move forward? How do we achieve universal health coverage? Again, we have the goal of achieving this in 2030. We're already in 2024. We barely have 6 years to go. How can we achieve this goal in 2030? So I have a few points here, and I said that we should have services that are focused on the people. People are important. If you are serving the people, then you should have services that are focused on them, people-centered services. And you can only do people-centered service when you communicate with the people that you are doing the services for. You ask questions. What are their challenges? What can you do to improve their healthcare access? And then we also need to invest in subnational health systems. This is a challenge in Africa because, like I mentioned earlier, you come to bigger cities like Lagos and you have all the healthcare that you need, but then you go to rural areas and then it becomes a challenge, right? So we need to invest in subnational health system. We also need to digitalize health system. Well, this might be a bit of a challenge again in Nigeria because we don't even have constant electricity. How do you make things digital when you don't have at least 24 hours of electricity? You come to the hospital and let's say that they cannot pull out your record because the computer is down and there's no electricity, But generally, I feel that when we digitalize our health system, it could or is a way of achieving universal health coverage because then you would be able to have access to your health information at every point in time. It can be in another part of Africa and I can reach out to my healthcare provider in Nigeria and, my healthcare provider in other country in Africa would have access to my health information because it is digitalized. When it is not, then it becomes a challenge, Another thing is that we need to prioritize community-led services and self-care, and then we need to increase health system resilience. I have down here again that we need to increase public funding for healthcare. It's very important. If we want to take away financial hardship on people, we need to increase the funding for public healthcare. And we need to also emphasize preventive care. Again, if something can be prevented, it should be prevented. The goal is that we should prevent it. We shouldn't allow it to get to the point of it becoming a disease. So I think that there needs to be more focus on prevention. People need to know what they can do to prevent themselves from having diseases. It's like malaria. What can I do to prevent myself from having malaria? Well, I keep talking about malaria because Nigeria is a malaria endemic region. So, what do you do to prevent yourself from having malaria? You use your mosquito nets, you ensure that your environment is clean. These are the basic things. So preventive healthcare is very important, and we need people to know how do you prevent yourself from having heart diseases. Don't consume alcohol. Do exercise. Ensure that you are not obese. Eat healthy. So preventive healthcare is very important, and people need to be made aware of that. For you to achieve universal health coverage, is that we need to place emphasis on preventive healthcare. And we need to strengthen our primary healthcare system. I've been saying this from the beginning of my presentation, that primary healthcare is in shambles in Nigeria. We need to strengthen it. I should be able to come to a primary healthcare center in a rural area and somewhere in Sokoto or Ebonyi. I should be able to see a doctor, a trained doctor to talk to me, to listen to me. I should be able to have access to quality healthcare providers in a primary healthcare setting. I shouldn't have to travel from one rural area, to Lagos for kidney transplant or for me to be able to see a cardiologist, for me to be able to see a nephrologist. No, I should be able to have access to, these basic things, even at the primary health care level, and then we need to promote public-private partnership. This is important because sometimes the government might not be able to reach everyone. And so when we have public-private partnership, it's in a way would improve or help us in achieving universal health coverage. Okay, I want to believe that we've learned one or two things from this presentation. What I wanted to do with this presentation is that you people need to know that universal health coverage is important, it is achievable, and we're hoping that in 2030, the goal of the SDGs is that in 2030, we'll be able to achieve universal health coverage. Again, we cannot achieve universal health coverage if people don't have access to healthcare, if the healthcare is not quality, and if they have to spend so much for the healthcare. No, right? So the aim of this presentation is for you to know what universal health coverage is, the importance of universal health coverage, and that everyone should be able to have access to universal health care. And I hope that with these few sentences, I've been able to, enlighten you about what universal health coverage is. And I hope to hear from you also. These are some of the references I used. And if at any point in time you want to reach out to me, yeah, these are my email address and you could reach out to me. Again, thank you so much, Adegoke Adeyinka, for such an opportunity and for all the works you are doing with the InStride Pathways Youth Foundation. I believe this is something very important that the youth need to know, and I'm glad that you're inculcating the secondary school students into this. This is amazing, and yeah, I hope to hear from you all soon, and I wish you all the best.
Welcome to this guest lecture where I will be throwing a lot of light on the Sustainable Development Goal number 9 that hits particularly at infrastructure development and innovation. So it's evening right now, my time, and whatever time you'll be watching this or whatever time it may be at your own location, I'm extending my regards. So before I get into what we have to do for today, I just want to extend my heartfelt gratitude to the InStride Pathways Youth Foundation for giving me the opportunity to speak to you out there and to be part of the beautiful objectives that guides this association, this foundation rather. I am very excited. I'm very excited. Looking through the descriptions of the aims, the objectives, the courses and the programs highlight, I can see that the initiatives, the ideas, and the people behind these ideas are very wonderful people, and the ideas are as wonderful as the people behind them themselves. So I applaud every bit of what is going on in the InStride Pathways. And moving on, let me also introduce myself so you get to know me better. My name is Essien Oku. I'm a PhD student at Drexel University, also college lecturer here in Drexel University. And entirely I'm a researcher, and I focus my research on climate communication, where I particularly look at misinformation about climate change on social media, and as well as the misrepresentations of climate change in regards to spirituality. So these are the things that interest me most, and from my experiences, especially in my active involvement with the United Nations Sustainable Development Goals, particularly right from when I was in Nigeria even up till now, I've been able to gather a lot of experiences that gets me excited to be involved in things like these, that we are in the decade of action. So the opportunity to speak to people regarding any of the sustainable development goals, especially goal number 9, which is my choices goal on innovation and infrastructure, it gives me a lot of joy. So I am so happy to be here. All right. So this evening, my time, I'll be speaking to you on bridging the infrastructural gap, analyzing Africa's industrial setbacks, and the imperative role of Western innovation and investment. I take that again. Bridging the infrastructural gap, analyzing Africa's industrial setbacks, and the imperative role of Western innovation and investment. Now, let's look at the contextual overview. Understanding the Sustainable Development Goal 9. So we have several goals, and then we are looking at the number 9 goal. And the number 9 goal spells out industry, innovation, and infrastructure. It emphasizes the importance of building resilient infrastructure, promoting inclusive and sustainable industrialization, and fostering innovation. So why is this goal even relevant to us with identities streaming from Africa, or even relevant for those persons inhabiting the four corners, permit me to use that word, the corners of Africa? Is because Africa's industrialization is crucial for the socio-economic development. Yes, although this is very important, you see that the continent faces some significant challenges in terms of infrastructure deficits, technological advancements, and industrial growth. Let's just flash back to centuries ago, when Africa was the cradle of civilization. I don't know how many of us know so much about Egyptology. Egypt, and the rest of it. You know that Egypt was the cradle of global civilization before things switched to Europe, and that's the Roman Empire and the rest of them. If you follow history very well, you see that Africa was at Africa was at the fore of development. Everything initially started from Africa, if I'm not mistaken, and then it becomes very pitiful, it becomes very pathetic to see that the continent, although I understand that the ancient Egypt spread across, the present day African territories and the rest of that. Yeah, that's Egyptian political territories. We don't really want to go into that. But what I'm trying to say is that drawing from the current impression that Egypt is in Africa, we can claim that Africa was the cradle of global civilization centuries ago. So, drawing from that, it becomes very pathetic for us to see that the continent is so left behind. A lot of persons want to leave the country, brain drain, migrations, a lot of things are happening. People want to leave the country because they feel that there are better resources, better infrastructural development outside the continent, which is not supposed to be so. So I feel that the Sustainable Development Goal number 9 aims to address this deficit, this technological meltdown, this backwardness. And for me, whenever anybody refers to the SDG, I feel it's not just what the government should do alone. It's not just what institutions or multinational firms should do alone, but it is what every one of us should collaborate in our various capacities towards bringing actualizations to these goals. So this goal is very relevant to Africa, and for me, I feel that Africa bears the most relevance to it, because if there is any continent that needs that needs very sincere infrastructural attention, is our beloved continent, Africa. Now, let's pay attention to some analysis drawn from a recent study. So I was able to, bring this into our discussion today, the current state of Africa's industrial infrastructure. Then if you look closely at this, these bars, you will look at this bar chart, this graph very well. You see that most African countries are very below the expected lines. They are so below the expected lines, and that's very pitiful. You see Somalia there. Somalia is a country in the Horn of Africa. You see it's the country with the lowest industrial infrastructure. Then you see Niger Republic. You see it just keep going that way, and then you see things become quite better from Cape Verde, see Algeria, see South Africa, we see Egypt, we see Libya, we see Seychelles. So you see that there is this terrible imbalance in the rates of industrial infrastructural development in Africa. See, whatever maybe the cause of this is arising as a result of different factors, different situations, different causative factors. But I'm putting it to everybody who's listening right now that it's not supposed to be like that. Things are not supposed to be like that, because Africa is blessed with the abundance of resources that can be utilized in ensuring that industries, startups, and the rest of it have access to good infrastructure for onward and sustainable development. But it becomes pitiful, it becomes very pathetic seeing almost all African countries so much below the standard lines. It is very pathetic. And then moving to the next slide, we are looking at infrastructural deficit, and then I particularly decided to look specifically at electricity in Africa. Now, why did I do that? Because I understand the role of electricity in development. It may look like the traditional power supply, but I want to let you, a lot of hospitals, like not even a lot of hospitals, medical centers, medical facilities need electricity to keep their isotopes, keep their instruments, their research is ongoing, keep their instruments functioning. A lot of companies cannot work effectively well in a place with crippled um, electricity, but it is pathetic that in a 21st century like ours, African countries still suffer terrible backwardness in regards to power supply, in regards to electricity. You look at the countries, you can if you look at the map there, you see that there are different percentages associated with these countries in regards to the availability of electricity in these countries. And then you see a country like Nigeria have 62%. This is a recent statistics. You see a country like Niger Republic 14%. You see a country like Chad 9%. You see a country, and then you look at I look at the countries in northern, like the Arab African countries. Those countries seems to be the ones really outstanding in regards to access to electricity. You see Libya, you see Algeria, you see Egypt having 99% access to electricity. This imbalance shouldn't be so. It shouldn't be so. Everybody should have right to good power supplies to be able to run their businesses, to be able to run their firms, to be able to run their parastatals and organizations effectively well towards meeting the needs of the masses who patronize them or request for their services. So you see, Africa goes through a lot in regards to electricity, and not just electricity. Look at energy, unreliable power supply, and inadequate access to electricity limits industrial activities. So you see, when that happens, because of poor access to electricity, there is the possibility for industrial growth to suffer. And then we see transportation. Transportation is also another thing facing another problem, another challenge facing Africa. You see poor road networks, underdeveloped rail systems, inefficient ports, increase the cost of doing business, and limit market access. You see, I don't want to mention countries specifically, but you see that Africa is strategically located with very rich maritime, but it's a pity that some countries, monopolize maritime access, monopolize seaport constructions, monopolize seaports development, and the rest of that. Even rail system, a lot of countries suffer from poor transportation because a lot of them still rely on those rail networks that were created or that were built during the colonial era. And if we are going to look into that very well, you see that the colonial masters were strategic in building those rail infrastructure because they had reasons behind the way they made things look like that. And post-colonial governance should not follow that pattern. But we see a lot of countries are still relying on those colonial patterns. It becomes a problem for people to have access to business opportunities, for people to have access to markets, large markets that will patronize their goods, their services for more income. So all of these things also add to poor industrial development in Africa. Now you look at the issue of digital infrastructure. I always tell people, if you could not achieve it of the digital space, I am doubting if you can make it in the digital space, because when referring to the digital space, this is where high level of technical know-how, expertise, and comprehension comes to play. So you see that limited internet penetration and insufficient digital infrastructure limits technological adoption and innovation. So Africa goes through all of this, and then you can now agree with me that these are some of the outstanding reasons why the continent is being dragged backward, or is dragging backward in terms of development, in terms of meeting up with the counterparts in Western countries. So when things happen like this, it calls for mass attention. It calls for the youth, policymakers, everybody involved, everybody who maybe Africans in diaspora, possibly Africans in the diaspora, and then Africans in the continent, to rise up and see to it that the factors contributing to these setbacks are resolved, and not just being resolved but sustainably resolved. Yeah. So and then decided to bring in this quick statistics of road fatalities in Africa. You see that because of poor roads, a lot of African countries are exposed to the dangers of human losses through road accidents. And one thing I want to point us to is that human resources owe a lot to the success of a particular geographical territory. Yes. But if because of bad road network, bad infrastructure, people keep dying unendingly, that country or that region, that territory is um, definitely losing the resources that should keep harnessing the natural resources. The territory keeps losing the human resources that should develop the natural resources for the development of that place. So it is a call for general response, especially for those Africans in the diaspora who are in well-placed positions, and those ones even in governance in the continent. Whatever position you find yourself, getting Africa out of the mess of poor infrastructure is not something that should be relegated to the hands of a few, but it should be something that everybody should do together, because it is our continent. And if we do not rescue it, strangers will not. Now let's look at the industrial challenges. First, having looked at what the setbacks, industrial setbacks, the areas where Africa is lagging behind the aspect of industry and innovation. Let's look at the challenges that accompany this. So I decided to keep things very brief. So the first one is low industrial output. Many African countries have low levels of industrializations, with economies heavily reliant on agriculture and raw material export. And when there is over-reliance on a particular sector or few sectors, there is a possibility for over-exploitation, and then and when that happens, it exposes that sector to drains. And when the resources they are massively drained without replacement, without any action to find alternatives to them, there is a possibility that they may not keep yielding as usual. And the world is a fast moving place. The world is always moving. So you don't always expect the people that keep buying from you today to always want to buy again tomorrow or next tomorrow, because they are also trying out their breakthroughs. For instance, Nigeria relies so much on petroleum exports amidst other kind of exportations. Then, assuming the United States is one of the major consumers of Nigerian petroleum products, and then they decide to find alternative to petroleum usage in America, that's going to be a big slap to the Nigerian petroleum market. And if the Nigerian economy is so much reliant on only petroleum, there is the tendency that the country will experience inflation and a terrible recession. So it is out of place for African countries to over rely on just one sector or few sectors just because it's yielding the gains. We never can tell what tomorrow would look like. And then we have skill gaps as one of the industrial challenges. The lack of skilled workforce capable of handling advanced industrial processes and technologies is a problem. Every year, young people leave Africa. Every year, young people leave the countries of African countries and then get into productive industries and workforces outside the continent. I want to let us know that as they keep living and taking their prowess, their experiences, their technical know-how, their abilities out of the continent into another continent, that keeps the next continent more developed. You know why? Because first of all, they have to serve the place they are before they can always think about home in most cases. So it is left for the people in leadership and every responsible forces operating in Africa to begin to craft sustainable ways through which young brains can be sustained, can be encouraged to stay back and then try to see to the utilization of African resources for her development. We have capital constraints, limited access to finance and investment needed for industrial expansion and modernization is also a problem, because when people tend to have access or feel they can have access to better funds outside Africa, they will migrate. And in some cases, I normally go into this debate, like sometimes people say, oh, brain drain, the Americas, European countries, Australian territories, they are really taking away African best brains. And I would say, well, it looks like brain drain is the key topic, but for me, it's not brain drain all the time, because sometimes the American countries don't particularly come to the country, or those Western countries don't particularly come to African countries, and then pick your best brains, then make their country, a place where people who settle there can have access to good opportunities, good funds. And because of that, everybody wants to go to where they can have access to good funds. And at this point, I don't see that as brain drain. I see that as people fighting for their own comfort. So what am I even saying here? Capital constraint. When people do not have access to the resources they should have access to, or when those resources are being restricted or are being kept away from public usage, there is the possibility that the people will begin to seek for alternative. And one of those easy alternatives is to find their way out of the continent. And that is so much to the detriment of the continent. Now, let's quickly analyze Africa's industrial setbacks. The first thing we're going to look is with underdeveloped industrial bases. When we are talking about the 19th century, when a lot of African countries, many African countries were under colonial rules, even up to the 20th century, So the primary motives of these colonial forces, the primary intentions of these colonial powers were to unearth the resources in Africa and then cut them back to their home countries for their development. We cannot deny that history, facts, and figures can attest to this. While that was very condemnable, it shows to a great extent that Africa's downfall can also be associated with it. But the problem lies if we keep referring to this as our primary downfall. Colonialism happened. We cannot turn back the hands of time. We just have to move on. And another thing is post-colonial development strategies. This is where I really have the problem. Political instability, corruption, and inadequate policy frameworks have hampered many post-independence development strategies. We understand that the colonial masters did a lot of bad things, and then that carpeted, that swept the continent's development under the carpet. I am saying this, I understand that colonialism also brought a lot of light to Africa, but I am looking at the dark side now for this purpose of this discussion. And then that is not even where I have the problem. I have the problem with the post-colonial strategies where corrupt public officials who have access to public funds do not engage those public funds for public good. And when that happens, the problems, the underdevelopment, the suffering that happened during the colonial era is being extended to the post-colonial era. And at this point, it's not the strangers, like we call them, causing this to us, but our very own flesh and blood, like our relatives. So at this point, when we are referring to Africa as a continent that is suffering from industrial setbacks, we can, without doubt, point to colonial factors and post-colonial factors. So yeah, a lot of African countries were really colonized by European territories, European countries like Great Britain, like you see in the picture. And then now let's look at the contemporary issues. One of the contemporary issues we are facing in regards to industry, innovation, and infrastructure is frequent changes in industrial policies and lack of long-term planning. So some time ago, I had the opportunity to attend the World Bank Youth Summit at the World Bank headquarters. And one of the things I drew out from some of the analysis that were done, some of the discussions that took place in that summit was that a lot of very talented and resourceful ideas are suffering from um, high taxations and terrible policies. One thing I know is that when policies becomes too stringent, when policies becomes too tough, too tight, there is that tendency that the people involved will will not be encouraged to continue. Too much regulations kill innovations. A lot of African countries don't know this. Too much regulations kills innovations. So one of the things that we should really consider, especially in this 21st century, is the innovations we put in place to regulate industrial activity. Sometimes these are actually the problem that hinders the growth of industrial development. Another thing is dependence on external market. Dependence on external markets. Reliance on export of raw materials makes African economies vulnerable to global market fluctuations. I said this before. If, for instance, these people don't want to buy again from us, possibly because they found alternatives, or maybe they are facing a level of recession and they want to cut their cost or their spending, the cost of their spendings, it will definitely affect African markets who are over reliant on these international buyers. And when that happens, it becomes a problem to the internationally generated revenue. So this points us to the need for us to develop our local markets, local production, local food production, local textile production, local production in any way that we can. We can, if we develop, if we invest in research and development. African countries also can, so that we can diversify economic reliance, not just monopolizing it in regards to a particular sector now, trying to get all the resources to move the country forward from a particular sector. Diversification should be the theme of every economic summit towards ensuring that everybody is part and parcel of the strategies that intends to move the economy of the countries or the continent forward. I speak as a Pan-Africanist, not just speaking for one particular country. I'm speaking across African countries. So another thing that hampers our infrastructural development, industrial development, is inadequate local innovation. Yeah, I've said this. So limited research and development capacities within the continent belittles and also cripples our local innovation. Now let's look at the role of Western innovation and investment anyway. As much as Africa is trying to come up, we cannot deny the fact that Africa is really behind. That is one truth we cannot close our eyes to. And then we cannot also deny the fact that there are countries ahead of us. So I believe it's one of my philosophies that if you see somebody who's doing better than you, you learn from the person and try to do as much as possible so you can do better and even do better and even do more than, and so that you can do like the person and even do better than the person. It's possible. So having drawn out that Western countries are actually doing far better than us, we can then also figure out the role they have to play in regards to helping us as Africans, and helping our continent, the African continent, towards coming to the standard of real and sustainable innovation and infrastructural development. Now, the first thing we're going to be looking at is technological transfer and innovation. As much as we've really talked about the bad side, the dark side of colonialism, but I also want to point out that contemporary Western government, contemporary Western policies are also helpful. They are really, especially those that are targeted in investing in Africa, they are really helpful. For instance, came across this news headline: China's Belt and Road Initiative in Africa, Kenya's pivotal role. That's China trying to invest in Africa's road network, and then we see that 48 million euros was intended by the UK, 48 million pounds rather, was intended by the UK government to boost and improve infrastructure in lower income countries. I don't know if anyone have access to this press release, you see that most of the countries targeted in these funds were African countries. And yeah, so 48 million pounds were being invested by the UK government to, improve infrastructure in lower income countries. And if you have the time to look at this press release, or if you've come across it, whatever um, means from wherever, you see that most of the countries that were being targeted were African countries. So they are actually trying. Technological transfer and innovation is actually happening. But I'm going to show you some of the problems that makes it look like these things are not really happening. Let's keep on talking. So you see that we look at we can refer to collaborative innovation, where Western countries partner with African nations to transfer technology, foster local innovation through joint ventures and partnership. And this is me telling you that it is actually going on. This is something that is really going on. Our government, the governments of African countries enjoy some of these relationship, these bilateral relationships, some of these partnerships with some Western countries who are willing to help. And then another thing is capacity building, investment in education and training programs to develop a skilled workforce capable of sustaining industrial growth. One country that I can really applaud, not just this one country, not just the United States, like I wanted to say, but other countries that give scholarship opportunities for students from Africa. You see, from my experience, from my visa interview experience, I realized that one of the things a visa officer looks forward to is how you would be able to tell how you can use your the knowledge you're going to be gaining in the advanced country like America or wherever to to help the situation in your home country. So the opportunity to provide Africans with providing Africans with the opportunity to have access to better standard of education, and then hoping that these people will return back to their countries and then utilize this knowledge acquired in the betterment of their country, is one of the ways these Western countries are actually helping the situations in Africa. So another thing is that Western investors collaborate with African government to develop critical infrastructure projects such as power plant, transportation networks, and digital infrastructure. And I can really applaud multinational companies, Chevron, Shell, and the rest of them in this regard. Sustainable development and Western technologies in renewable energy and sustainable infrastructures are crucial in developing Africa's industrial base without exacerbating environmental challenges. Yeah. So these are some of the things that takes place. Now let's look at this infrastructure investment strategies. One of the investment strategies that I want to point out is long-term investments. As I am painting the efforts from the Western governments so wide and so good enough, I have some recommendations I think they can also work with. And that's emphasizing long-term sustainable investment rather than short-term profits to ensure lasting impact on Africa's industrialization. We understand that some of these multinationals that have come to Africa, one of the things they also want to do is to gain from Africa's resources while also meeting up with their corporate social responsibilities. Yes, and it is always the hope of African communities that house or host these companies that they would stay longer and then try as much as possible to contribute to the development of such places. And then we have inclusive investment, targeting investment that benefits local communities. As much as these investment strategies are in place, the local communities should not be left behind, like creating jobs, creating education opportunities, and the rest of them. Well, I understand that ongoing collaboration between local startups and Western tech companies is spurring growth in Nigeria's digital sector. I understand. However, this industry, like others, beckons for more. Now, I realized in 2021, when I had the opportunity to travel to Nasarawa State in Nigeria, that's North Central region of Nigeria, I had the opportunity to conduct an observational research which was later presented at Utah Valley University in the United States of America in 2022 about wealth creation and urbanization strategies. I realized a lot of women who are especially in the process of food production in this part of the country, like in other parts of the continent, are suffering from poor infrastructure, suffering from the absence of machineries that can help them produce their foods in large quantities and without so much stress like I witnessed. So, and this had informed my research, which is displayed here. Now, why did I even bring this here? There is the need for multinational companies, these firms, these international industrialists, experts who are hosted in such communities to see to it that these people or the local communities are provided with such amenities, such facilities, such infrastructure. It will not only be a traditional fulfillment of corporate social responsibilities, but it will better the life of those people there. They are humans also, and they need that comfortable attention that should be given to them. Well, still, I understand that Western countries are trying, but our countries, African countries, are really suffering under the weight of corruption, mismanagement, and political instability. For instance, we have some African countries that keep switching from different forms of government. We have those that are actually practicing the same form of government, but only a few people have access to the resources, and then they don't bring it out for they don't allow general or public access, and the rest of it. Some persons are overcompensated while others are undercompensated. So there is no uniformity in the dissemination, the distribution, rather not dissemination, in the distribution of the resources. And when this happens, some of the funds that comes in from Western organizations, Western parastatals, Western firms get into the wrong hands and they are squandered, they are looted, making it look like this money don't actually come in, but they do. So it is always an appeal to those in governance, wherever country you may be, whether in Nigeria, or whichever African country, it is necessary that the funds that get into the country are utilized, because when these funds are not effectively utilized, there is a possibility that the people, the residents, the inhabitants of that geographical territory would not see whatever the Western guys are doing for that place. So it is the role of every government, to sack corruption, to ensure that corruption is played off and not given a chance to manifest or rear its ugly head. And then just quickly, let's look at some policy recommendations that can be, adopted by some African countries, by African countries anyway. So African government needs to build robust institutions that can support industrial policies and ensure transparent and efficient use of investment. Very necessary. And then government and the private sector should prioritize innovation through increased research and development funding. One of the things that keeps Western countries going is prioritization of research and development, and this is very necessary. So fostering local entrepreneurship and supporting startups. Another thing is investing in sustainable and resilient infrastructure that can withstand economic and environmental challenges. So just before I close this talk this evening, I want to let us know that bridging Africa's infrastructure gap is not just about investment, but also about fostering innovation, building local capacities, and ensuring sustainable development. Achieving SDG 9 in Africa requires a collaborative effort between African nations, Western countries, international organizations, and us. That is you and me in our different small, medium, or large capacities towards creating a prosperous and industrially developed continent. So we can't leave it for just one person, can't leave it for just one group of people. It is our collective assignment, and hopefully we should be able to live up to it. All right, so it was nice really talking about this. Um, Talking about Africa's infrastructural setbacks is something that brings a lot of concerns to me, because as an African, I derive a lot of unhappiness from that. It makes me feel very unhappy. But I feel that if we can take things serious and then try as much as possible to fight corruption, because if you want to look at the impact of corruption on our development, you see that it's a cankerworm that has eaten so deep into the fabrics, and if not stopped, it will eat up everything like locusts eating green plant. And there is need for us in our various capacities, in our various levels, to rise up and say no to corruption, put our feet on the ground, invest in our own countries, and then try as much as possible to ensure that funds, when distributed, are allowed to be used for the purposes where which they were intended for. And if we can do this, I am hopeful that Africa can begin to wear the face we want it to wear. And most of the people in the diaspora may not really feel very happy to leave their home country and go to a very strange land. A lot of people want to come back, but don't want to go back to a place where there is no prioritization of research and development funds, or no, comfortable access to electricity and rest of other social amenities. So if Africa can begin to wear the face, which is an assignment we all have to fulfill, then I am sure that a lot of human resources that have, left the walls of Africa, permit me to say, will be willing to return. And it is my clarion call to the people outside of Africa, African in the diaspora, that you may be out there, but Africa still needs your attention. Africa still needs your technical know-how. Africa still needs your contribution. And even those who are yet to leave the country, who are not seeing the dream of leaving the country, always know that it is not enough to leave the country, but it is enough to leave the country to give back. So because you can always run, but you can't run away from your identity. So let me leave you with this one word: Africa is our own, and we cannot afford to let it sink. Thank you so much. It was so nice speaking with you. Bye.